So if you don't have a menopause practitioner near you, or your OBGYN isn't willing to talk about menopause and says that there's no use testing, there are menopause specialists. And if you would like to find a menopause specialist in your area, you can go to menopause.org and type in your zip code and find practitioners in a 50-mile, 25-mile, whatever radius. If there are no healthcare practitioners near you, you can do a telehealth option like Alloy, which I use for my topical estrogen face cream. And if you want to get $20 off your consult or your estrogen cream, you can use the code Wendy20. These are true healthcare practitioners, menopause specialists, leading the charge on women's health. You don't actually need to struggle anymore. You have to find a person. So you're going to have to push a little bit to find a menopause specialist, menopause.org, or you do a telehealth option like Alloy. And telehealth is legit when you have perimenopause, menopause symptoms, because the way we determine that, the greatest way you determine that, brace yourself, is your subjective reports. Now, of course, they are going to rule out any other things to make sure you don't have diabetes, thyroid issues, something else. But the greatest way to diagnose perimenopause and menopause is by subjective complaints from you. Because our hormones change all the time, every day, all throughout the cycle. Okay, so yes, blood work can tell us when you are postmenopausal or very close to being menopausal by checking your FSH and AMH. But the perimenopause stuff, when you feel crazy and you don't know what to do, and you talk to your doctor and your doctor says, I'm not going to have this conversation to your 365 days since your last period, because that is the technical definition of menopause. But perimenopause can start 5, 10, 15 years prior to menopause, and that is when you begin to feel like garbage. So if you don't have a doctor, menopause.org, try a telehealth option. But do please try to have that conversation with your doctor. And you can't force your doctor's hand. If your doctor is dead set against it, you cannot force doctor's hands. I can encourage you to read the book Estrogen Matters. If you have not read that yet, it is game changer. If I had found that book, I could have saved myself a month of research for my book, because that book, is amazing. And it reads well, and it's well cited. Beautiful book. So anyway, don't suffer, ladies. Please do something. I love you. Bye.